Welcome to our deep dive today. We're going to be looking at how the social world around us shapes our mental well-being. We got a really interesting mix of sources for this one.
Yeah, we do.
Academic handbooks,
Mhm.
research papers, and even some historical perspectives.
It's a fascinating area, isn't it?
It is, and we're going to try and pull out the most interesting bits for you today.
Yeah.
So get ready to discover how things like class, gender, and culture can actually play a surprising role in mental health.
You know, we often think of mental health as something very personal, but these sources really challenge that idea. They highlight how our mental well-being is actually intertwined with all the social structures around us.
Okay, so let's get specific. What kind of social structures are we talking about here, and how do they actually impact our mental health?
Well, think of it like this. Imagine a tapestry woven from these threads of class, gender, cultural norms, all these larger forces that make up the fabric of our lives. And these threads can profoundly affect our mental well-being. It's not just about individual personality traits, but also the taxing living conditions that people face.
So it's like saying that where you stand in society can actually influence your chances of experiencing mental health challenges.
Exactly. For instance, if you're constantly battling poverty or discrimination or a lack of opportunity, it's bound to take its toll on your mental health. And what's even more thought-provoking is that some researchers suggest that even our understanding of mental illness itself might be influenced by these very same social factors.
Wait, so how we actually define mental illness could be shaped by society. Tell me more about that.
Absolutely. There's a study by Morowski and Ross that argues that the traditional categories we use to diagnose mental illness might be more fluid and influenced by social contexts than we think.
Okay.
They use this interesting phrase, mythical entities, to describe these diagnostic categories, suggesting they're not as fixed or universally applicable as we might assume.
That is really interesting. So are they saying that mental illness isn't real then?
Not at all. But they're encouraging us to consider how our social surroundings shape how we experience and label mental distress. This is especially relevant when you think about how differently various cultures view mental health.
That's true. Some cultures might stigmatize mental illness, which leads people to hide their struggles, while others might encourage seeking help. And of course, access to good quality health care plays a huge role in whether people get the support they need.
Precisely. All of this suggests that relying solely on a medical approach to mental health might miss a big piece of the puzzle.
It's like trying to treat the symptoms without understanding the underlying social causes, right?
Exactly. It brings to mind the work of Emil Durkheim, a pioneering sociologist who studied suicide rates over a century ago.
Ah, yes. Durkheim, didn't he discover that social factors play a huge role in suicide?
He did, and what he found was groundbreaking. He linked suicide rates not to individual despair, but to things like how integrated people felt in their communities and the level of social regulation,
Right.
the rules and norms that guide behavior.
So people who feel isolated or like they don't belong are more vulnerable.
That's what his research suggests. He found that suicide rates varied among different religious groups and even changed during times of war. This highlights the power of social forces in shaping even the most personal of decisions.
Wow, that's really powerful. It makes you think about how interconnected we all are.
It does, doesn't it? And it makes you wonder about this trend we see today, the increasing medicalization of mental health.
You mean how more and more behaviors are being classified as mental disorders?
Exactly. And while this can be helpful in reducing stigma and encouraging people to seek help, it also has its downsides.
Such as?
Well, it can lead to an over-reliance on medication as the primary treatment, sometimes at the expense of addressing the social and environmental factors that contribute to mental distress.
It's like sticking a plaster on a broken leg. It might cover the problem temporarily, but it doesn't fix the underlying issue.
That's a great analogy. And this brings us to another critical factor that emerges from these sources, stress.
Oh, I think we all know a thing or two about stress.
Indeed. But what's important to remember is that stress isn't just a feeling. It's a physiological response to challenging situations.
So it's not just in our heads, it's actually happening in our bodies too.
Exactly. The sources make a clear distinction between stressors, the things that trigger stress, and the stress response itself. These stressors can range from discrete events like a job loss to chronic ongoing problems like living in poverty.
Okay, so different types of stress can impact us in different ways. But what determines how well we cope with stress?
That's where social support comes in. The sources make a really compelling case for the power of social support in buffering the negative effects of stress.
So having strong relationships and people we can rely on can actually protect our mental health.
That's what the research suggests. And it's not just about the number of connections we have either. It's the quality of those relationships and the feeling of being genuinely supported that makes the difference.
It's about knowing that you're loved, valued, and that someone has your back right.
Absolutely. And interestingly, studies show that women often report higher levels of perceived social support than men.
Oh, that's fascinating, especially considering that women also tend to report higher levels of depression and anxiety.
It's a complex interplay of factors, isn't it? Speaking of complex, Faith, we can't ignore the relationship between work and mental well-being.
It's a topic that's probably on a lot of people's minds these days, especially with all the changes in the workplace.
You're absolutely right. The sources highlight the negative impact of jobs with low control and high stress. Think tight deadlines, limited autonomy, and constant pressure to perform.
Sounds like a recipe for burnout.
It can be. And they contrast this with the potential benefits of work that offers more autonomy, intellectual stimulation, and a sense of purpose.
So finding work that aligns with our values and gives us a sense of control is key.
It seems to be a significant factor. And of course, we can't forget the mental health effects of unemployment, which can lead to financial strain, loss of identity, and social isolation. It's a real domino effect.
It certainly is. And all of this ties into the complex issue of social class and mental health, which these sources delve into quite deeply.
There's this long-standing debate about whether lower socioeconomic status actually causes mental illness, or if people with mental illness are more likely to drift down the socioeconomic ladder.
So which is it? Is it a case of poverty leading to mental health problems or mental health problems leading to poverty?
It's likely a bit of both. There's evidence to support both sides of the argument. Some research suggests that poverty, stress, and a lack of opportunity increase the risk of mental illness, while other studies point to the challenges that individuals with pre-existing mental health issues face in education and employment, which can then lead to downward mobility.
It sounds like a bit of a vicious cycle.
It can be. And to add another layer of complexity, there's the whole question of gender and mental health.
I'm really curious to hear more about that. It's always fascinating to explore how men and women experience and cope with mental health challenges differently.
One of the key observations is that women tend to experience higher rates of depression and anxiety, what researchers call internalizing disorders.
While men are more prone to substance abuse and antisocial behavior, or externalizing disorders.
That's the general pattern, and the sources explore various potential explanations for this, looking at social roles, expectations, and even biological differences.
So are they saying it's all down to nature or nurture?
It's likely a combination of both. Some researchers argue that traditional gender roles, where women are often socialized to be more emotionally expressive and nurturing, while men are encouraged to be stoic and independent, might play a role.
Right, that makes sense. And this could also be tied to the fact that women are often the primary caregivers in families, which can be both rewarding and incredibly stressful.
Absolutely. And then there are the power dynamics at play. Women often face more discrimination, earn less money, and have less control in their work lives, which can lead to feelings of helplessness and low self-esteem.
It's a lot to unpack.
It is, and we can't overlook the impact of race and ethnicity on mental health either.
Yeah, this is an area where I think we need more awareness and understanding, especially with the unique stressors that minorities face.
You're absolutely right. The sources highlight how racial and ethnic minorities often contend with discrimination, prejudice, and social inequality, all of which can profoundly impact mental well-being.
And to make matters worse, access to culturally sensitive mental health care is often limited as well.
It is, and that's why it's so crucial to have more research and resources to address the specific mental health needs of diverse communities.
Absolutely. And finally, we need to talk about the often troubling intersection of mental illness and the criminal justice system.
This is a critical issue that the sources really delve into. There's a phenomenon known as the criminalization of mental illness, where individuals with mental health problems are disproportionately represented in the justice system.
It's almost as if we're punishing people for their illnesses instead of providing them with the help they need.
It's a complex issue with many contributing factors, including a lack of access to community-based mental health services, inadequate police training, and the stigma surrounding mental illness.
It's heartbreaking to think about, but this is where the role of nurses becomes so crucial.
It really is. Nurses are often on the front lines interacting with individuals with mental health issues in a variety of settings. They have the potential to make a real difference.
So what can nurses actually do to help? How can they advocate for their patients and push for systemic changes that address these social injustices?
That's a great question, and one that we'll explore in detail in the next part of our deep dive. We'll look at specific strategies that nurses can employ to provide compassionate care, advocate for better access to resources, and help create a more just and equitable society for all.
This is really insightful stuff. I'm eager to learn more about how nurses can make a difference, and I'm sure our listeners are too. We'll be right back after a short link.
So let's delve into how nurses can actually make a tangible difference in supporting the mental well-being of their patients.
Yeah, I'm really keen to hear this. We've talked about all these challenges, but now let's focus on solutions. What can nurses actually do to make a positive impact?
Well, one of the most powerful things nurses can do is advocate for culturally sensitive care.
That makes a lot of sense. We've talked about how mental health can manifest differently across cultures. A one-size-fits-all approach just won't cut it, will it?
Exactly. A nurse who truly understands their patient's cultural background can interpret symptoms more accurately, tailor their communication style, and build a much stronger rapport.
It's about meeting people where they are, respecting their beliefs and values, and acknowledging the unique ways those factors might actually shape their experience of mental illness.
Precisely. And beyond cultural sensitivity, the sources emphasize how vital it is for nurses to recognize all the broader social factors impacting their patient's mental health.
So, for example, a nurse might notice that a patient's depression is worsening because of a recent job loss or ongoing financial strain. They wouldn't just treat the depression in isolation, would they?
Exactly. They'd look at the whole picture, considering those social determinants of health that are playing a significant role. They might connect the patient with social services or support groups or other resources that can address those underlying issues.
It's about treating the whole person, not just the diagnosis.
Absolutely. And this leads to another crucial area where nurses can advocate better access to community-based mental health resources.
Yeah, we know there's a real shortage of affordable and accessible mental health care services, especially in underserved communities. What can nurses do to address that gap?
Well, nurses can be powerful voices for change. They can work with policymakers or community organizations and other healthcare professionals to expand access to these vital services. They can raise awareness, advocate for increased funding, and even help to develop new programs.
So it's about stepping outside the clinical setting and engaging with the wider system to make those services more available to everyone who needs them.
Precisely. And they can also support policies that address the social determinants of mental health on a larger scale.
What kind of policies are we talking about?
Think of things like affordable housing initiatives, anti-discrimination laws, and programs that reduce poverty. These are all upstream solutions that can create a much more supportive and inclusive society for everyone, ultimately contributing to better mental well-being across the board.
It's about shifting from a reactive approach to a preventative one, tackling the root causes of mental health disparities.
Exactly. Now, let's get a bit more specific and look at how this plays out in different healthcare settings. Let's start with primary care, where nurses are often the first point of contact for patients.
Yeah, it's that initial interaction that can make such a difference. What role can nurses play in primary care when it comes to mental health?
Well, one crucial role is screening for mental health issues.
So using standardized questionnaires or simply asking open-ended questions to kind of gauge a patient's mood, anxiety levels, or sleep patterns.
Exactly. And if they pick up on any red flags, they can refer the patient for a more thorough evaluation or connect them with appropriate resources.
They can also provide education and counseling on stress management techniques, healthy coping mechanisms, and the importance of building strong social support networks.
And let's not forget their key role in medication management. Nurses ensure that patients understand their medications, they monitor for any side effects, and help them to stick to their treatment plans.
Now, what about hospital settings? Nurses often care for patients experiencing acute mental health crises in these environments. What are some of the challenges and opportunities there?
In hospitals, nurses provide essential crisis intervention and stabilization services. They create a safe and supportive environment for patients, they administer medications as needed, and closely monitor their condition to ensure they're getting the immediate care they need.
It's about being present, providing reassurance, and helping patients to navigate that acute phase of their illness.
Absolutely. And just as important is the role nurses play in discharge planning. They work with patients and their families to ensure a smooth transition back into the community.
So that might involve connecting them with community-based mental health services, support groups, or other resources that can help to prevent readmission and support their ongoing recovery.
Exactly. Now let's shift our focus to mental health clinics and community mental health centers. These settings offer a wider range of services, don't they?
They do. Nurses in these settings provide individual and group therapy, medication management, and case management. They're often wearing many hats, aren't they?
They are. They work as part of multidisciplinary teams, collaborating with psychiatrists, social workers, and other mental health professionals to provide comprehensive care. They might also be involved in community outreach programs, educating the public about mental health and challenging the stigma that still surrounds it.
It's about bringing mental health out into the open and making it part of the conversation.
Absolutely. And finally, we need to consider the challenging role of nurses working in correctional facilities.
Yeah, this is a really demanding environment where nurses are providing mental health care to individuals who are incarcerated.
Hmm.
What unique challenges do they face?
Well, they might be dealing with a complex mix of mental health issues, substance abuse disorders, and trauma, often compounded by the stress of incarceration itself. It's a highly demanding role.
So nurses in these settings need to be skilled in crisis intervention, de-escalation techniques, and trauma-informed care. They need to be able to build trust and rapport with individuals who may have experienced significant adversity and trauma.
And they play a crucial role in advocating for the rights of incarcerated individuals with mental health needs, ensuring they have access to appropriate treatment, medication, and support services.
It's about upholding their dignity and ensuring that their needs are met, even within a challenging and often restrictive environment.
You've hit the nail on the head. As you can see, nurses are incredibly versatile and vital members of the mental health care team.
They really are. They're making a difference in countless ways, from providing direct patient care to advocating for systemic change. But beyond their clinical skills, there's something else that sets nurses apart, isn't there?
You're right. One of the things that really shines through in these sources is the emphasis on compassion, the ability to connect with patients on a human level, to see the person behind the diagnosis.
It's that human connection that can make such a difference, especially for someone struggling with their mental health. It's about offering empathy, a listening ear, and a sense of genuine understanding.
Absolutely. That human touch can help to reduce feelings of isolation, build trust, and inspire hope.
Ultimately, it's about empowering individuals to navigate the challenges of mental illness and to live full and meaningful lives.
And that brings us to a point that's often overlooked but incredibly important: the need for nurses to prioritize their own mental well-being.
Yeah, it's so easy to forget that those who care for others also need to be cared for themselves.
You're right. Nurses face a lot of stress, compassion fatigue, and even vicarious trauma, especially in mental health settings. They need healthy coping mechanisms, strong support systems, and access to mental health care services themselves.
If they don't prioritize self-care, they risk burnout, compassion fatigue, and even their own mental health challenges. It's like that saying, you can't pour from an empty cup.
Exactly. Taking care of yourself isn't selfish. It's essential to being able to provide quality care to others.
It's about recognizing your own limits and making sure you're replenishing your own well of compassion and resilience. Otherwise, you simply can't keep giving to others.
That's so true. And it's something we need to talk about much more openly in healthcare. We need to create a culture that supports nurses in prioritizing their own mental health.
We've covered a lot of ground in this deep dive. We've explored the societal forces that shape mental health, the limitations of a purely medical model, and the myriad ways that nurses can make a difference. But there's one more piece of the puzzle we need to address, isn't there?
You're right. We can't forget the vital role of research in advancing our understanding of mental health and developing more effective treatments and interventions.
This is where nurses can make such significant contributions, isn't it? They're on the front lines, they see the gaps in knowledge, and they have such a deep understanding of the patient experience. They're ideally placed to drive research forward.
They are. Nurses can identify areas where more research is needed. They can conduct studies, and they can translate research findings into practice. They can also help to evaluate the effectiveness of different interventions and programs, ensuring that mental health care is truly evidence-based and meets the needs of those it serves.
So it's a call to action for nurses to embrace their role as researchers, contributing to the growing body of knowledge in this field.
Absolutely. The more we understand about the complex interplay of social factors and mental health, the better equipped we'll be to create a more just and compassionate world.
A world where mental health is valued and supported, and where everyone has the opportunity to thrive, regardless of their background or mental health status.
It's a vision worth striving for, and one that nurses can play a crucial role in realizing.
I'm really inspired by the insights we've gleaned from these sources today. It's clear that social factors have a profound impact on mental well-being, and that nurses are uniquely positioned to make a positive difference. But before we wrap things up, I'd love to hear your final thoughts. What's the key takeaway you want our listeners to ponder as we conclude this deep dive?
Well, I think for me, the most powerful takeaway is this idea that mental health isn't just an individual issue. It's deeply intertwined with the fabric of society as a whole. We've seen how everything from class and gender to race and culture can really shape our mental well-being.
Yeah, and we've also seen how a purely medical approach, while important, can't fully address the complex interplay of social factors that contribute to mental health challenges. We can't simply treat the symptoms without acknowledging that broader context, in which those symptoms arise. It's like trying to solve a puzzle without all the pieces.
Exactly. And that's why the role of nurses is so vital. They're not only skilled clinicians, but they're also advocates, educators, and compassionate caregivers who understand the profound impact of social determinants on mental health.
We've explored so many practical ways that nurses can make a difference, from advocating for culturally sensitive care to pushing for better access to community resources, supporting policies that address social inequalities, and even engaging in research to advance our understanding of mental health.
It is inspiring, isn't it, to think about the ripple effect that nurses can create, not just in the lives of individual patients, but in shaping a more just and compassionate society as a whole.
It really is. And it makes me think about something you said earlier about the need for nurses to actually prioritize their own mental well-being. They can't pour from an empty cup, right?
Absolutely. If we want nurses to be effective in supporting the mental health of others, we need to support them in taking care of themselves. That means creating a culture that values self-care, provides access to mental health services, and encourages open conversations about stress and burnout.
It's about recognizing that nurses are human too, with their own needs and vulnerabilities. They deserve the same compassion and care that they so readily extend to others.
I couldn't agree more. Now, as we wrap up this deep dive, I want to leave our listeners with a final thought to ponder. Considering everything we've discussed today, what aspects of your social environment might be impacting your own well-being?
That's a powerful question. It invites us to turn the lens inwards a bit and examine our own lives, to consider how the social forces we've been discussing might be playing out in our own experiences.
And building on that, what steps can you take, however small, to create a more supportive and inclusive environment for yourself and those around you?
It's a reminder that we all have a role to play in shaping a world where mental health is valued and supported, and where everyone has the opportunity to thrive.
This deep dive has only scratched the surface of this complex and fascinating topic. There's so much more to explore, and I encourage you to keep learning, keep asking questions, and keep engaging in these conversations about mental health.
Thank you so much for joining us on this journey of discovery. We hope you found it insightful and thought-provoking, and perhaps even a little bit inspiring. Remember, mental health matters both for ourselves and for everyone around us.